Hi, I am Dr. Felice Gersh, your integrative OBGYN physician, and today we're going to talk about a very important topic which has been very trendy, but for very good reasons. It is fasting. And I want to bring it up because it not only is trendy, as I said, for good reason, but there are ways to do it right and there are ways to do it wrong. And women and men are quite different in how they will respond to fasting and sometimes how they should even do it. So let's get down to the nitty-gritty. So what exactly is fasting? Well, technically, fasting is any time you're not eating, right? But there are certain actual, we'll say, cellular mechanisms that will be initiated within the cell based on what type of fasting you have. All fasting is not the same. So let's talk about types of fasting. Well, there's a lot of question about the nomenclature. So a lot of people will talk about intermittent fasting. And I always say, well, tell me exactly what you're talking about because I have no idea what they mean when my patient says I'm doing intermittent fasting. I don't know what you think it means, but it really is not a clear-cut anything. So a lot of people think that intermittent fasting means that you don't eat until sometime into the afternoon. That is actually not what it's about. But you might say that intermittent fasting is technically not eating all the time. Okay, so let's talk about what we should be saying and how we should talk about fasting. Well, when you do certain fasts within the 24-hour day, that actually is called time-restricted eating. For animals, when they do studies, they call it time-restricted feeding, okay? Because you feed an animal, but we just kind of feed ourselves, so we call it eating. So what is time-restricted eating within the 24 hours? Well, it's whatever you make it to be. So what is ideal? Well, it's based on our circadian rhythm, the 24-hour clock that is built into us because we are earthlings. We evolved on planet Earth to be in this beautiful synchrony with our universe. It's so amazing. So the Earth has a 24-hour rotation on its axis. So we have day and night. And so there are certain creatures on this planet that are nocturnal. They do their most activity during the night and they sleep during the day. And we humans are diurnal. We are supposed to sleep at night and are most physically active during the day. Okay, well, that's going to apply to how our digestive system works and how insulin is going to function. So it turns out that our digestive tract is programmed, absolutely programmed with our clock genes to work best in the first half of the day. We'll have better digestion. Everything is going to work better. Now, what about insulin? Well, it turns out, similarly, our insulin sensitivity, insulin works better in the first half of the day. So if you eat identical meals in the early part of the day, you will have a certain excursion. Your insulin and your blood sugar will go up a certain amount. If you eat that identical food, everything identical, late in the day, you will have a higher rise in glucose, blood sugar, and a higher amount of insulin required to try to bring it down. So that is why it is far better. I'm not saying you can't be somewhat healthy, but studies, in fact, a recent one just came out showing you may think that it's good to eat late at night and fast through the first half of the day, but it is not. So it turns out that you will lose weight much more readily if you eat most of your food in the first half of the day. That's why we say if you're going to have dessert, something a little decadent, actually have it for breakfast, morning meal. Now, if you eat most of your food in the morning, your digestive system will work better as well, as I mentioned. So people who have GERD, gastroesophageal reflux, are much more likely to have bad symptoms from it in the evening. A lot of people have figured this out. They stop eating early because otherwise they get so much heartburn. Well, you don't want to have bad digestion. You don't want to have high levels of blood sugar and high levels of insulin to follow. So try really hard to eat most of your food for breakfast, or if that's not doable, for lunch. And remember, breakfast is just a time of day. So think of it as morning meal. You can have dinner foods. You can have healthy foods. In fact, I don't want you to have conventional so-called breakfast food in the morning. I always advocate for a breakfast salad. Lots of wonderful vegetables, fruit, nuts, seeds, and some kind of either nuts, or you could or like beans, or you could add in a little bit of animal protein into your morning salad, and you'll be full for hours to come. Now, when we talk about intermittent fasting, when we're talking about time-restricted eating, that means how you eat in the 24-hour day, you want to have about a 13-hour fast from dinner to breakfast, and have breakfast within 2 hours of awakening. That is best for your metabolic health. If you want to lose weight or be metabolically healthy, you want to do what I'm telling you, okay? It's just how we're made with our clock genes. So when you have high blood sugar and then high insulin to follow, you are more likely to have weight gain, because insulin promotes the development, production, and storage of adipose tissue fat. And if you have high blood sugar, that's bad for everything. It creates inflammation. You do not want to have that. So try really hard to eat most of your food in the first half of the day, and eat a light, early dinner, and have it 13 hours from dinner to breakfast. Now, you could extend that fast and have an earlier dinner and make it 14 hours or even 15. And I'm not against it, but the return on investment is not that huge. You get most of the benefit if you fast for 13 hours. If you fast longer than that, that's okay, but it's not exponential growth. Like for every hour you add, you're going to get a percentage equal to that. It's like kind of plateaus and levels off. So especially it gets so hard to fast longer than 13 hours. So just aim for 13. That's kind of a sweet spot. There were some studies published a while ago showing that women who'd had breast cancer, if they fasted for 13 hours, they had a significantly lower rate of recurrence of breast cancer. So that's pretty darn good data. Now, what do we want to do when we do time-restricted eating during the 24 hours? Stop snacking. Don't eat more than 3 times a day to give your gut a chance to rest and recover. And every time you eat, you're going to have some increase in blood sugar and insulin, which is going to create more metabolic dysfunction and weight resistance. Like losing weight will be harder, or you'll gain weight. So try hard to not eat more than 3 times a day. Snacking, once upon a time, not that long ago, people advocated for eating like every 2 hours. That is ridiculous. Your body is capable of burning fat. We're not required. Can you imagine if the human race had to eat every 2 hours to survive? Of course, we did not evolve for that, which gets us into the next type of fasting, which could be called intermittent or periodic fasting. This is where we're not talking about fasting during the 24-hour day. We're talking about multi-day fasting or full-day fasting. So one of the types of fasting that was developed was called the 5-2. And it turns out that the 4-3 actually works better. So what is that? Well, the 5-2 was 2 days out of the week, 2 days out of 7, a person would stop eating altogether, just have water, or now they've modified it and they call it a modified fast, that you can eat up to, but not more than 25% of your normal caloric intake, okay? So that would be when you have the 5-2. Now, as I said, it's actually better if you fast or do a modified fast for 3 days out of every week. That is really tough to do. So what is another solution? By the way, if you do that, you will tend to have less inflammation and lose fat. So that's a good thing. It's just really, really hard to do. You'll lower your risk of diabetes. You may even reverse it. But no one, very few people will say, can sustain eating very little or nothing 2 to 3 days a week. So that's where you can have periodic fasting, where you do, say, once a month fasting. And that could be with a water fast, where you fast for 3 or 4 days continuously, sequentially. So you have nothing to eat but water for 3 to 4 days. And you could do that multi-months in a row. Now, what's good about that? Well, when you get out to 3 days of water fasting, you not only will have weight loss, and that is good if you need it, and that's what most people need, you will also trigger mitophagy and autophagy. So what is that? That is cellular renewal. Cells renew from within, kind of like if they don't get any nutrients, after about 3 days, they say, uh-oh, no food, no nutrients coming in. We better recycle our own cellular components. So healthy cells will break down some of the cell membrane components within the cell organelles, and then reconfigure, remake new ones. So I call it intracellular rehab, and that's called autophagy. Well, something similar can happen in mitochondria, the energy-producing factories of cells. And they will actually rejuvenate as well, which is really important because have you ever thought of how do you lose weight? You lose weight by burning glucose and your stored fat, right? You've got to burn the fat that you have if you're going to lose weight, okay? Well, what burns it? The mitochondria. Well, we want them to be really healthy and robust, and they tend to decline in their capabilities, especially in women. That's what I'm going to touch on. The difference between men and women is that women tend to have more difficulty maintaining their mitochondrial function as they age because it requires adequate estradiol, which of course we naturally lose when we go through menopause, unless we get it replaced. But even then, it's not the same as being 21. We can't do that yet. So when you fast with a water fast for about 3 days, and you can go to 4 days, you will trigger this mitophagy and autophagy, which is really, really beneficial. Now, you will also tend to start burning the yucky fat of the body, the visceral fat, the fat that's stored in organs like the pancreas, the bone marrow, the heart, and the liver. So we definitely want to do that. We want to burn that yucky fat really, really well and thoroughly. So that usually takes these multi-day fasts, or we call periodic fasting. So that can be very helpful. But here's a problem. Very few people will do this because it turns out that just doing a one-time 3 or 4 day water fast isn't going to be adequate. Not one and done, sorry. You have to do it if you really have insulin resistance, metabolic dysfunction. You have to do it every month. You want to reverse diabetes, prediabetes, you got to do it for several months. And you want to get rid of your liver fat, many months. Every month, over and over, you have to do this periodic fasting. So that's where they invented the fasting-mimicking diet. It's more doable, and it has other benefits because you're now eating, you get nutrients as well. So that's why a lot of people are turning to the fasting-mimicking diet. But there is, of course, the water fast that you can do as well if you're so capable, which personally I've never been able to do it. But, water fasted a little bit. But not much because I just tend to get too hungry. So most people are much better off with a fasting-mimicking diet. But when you do that, you really trigger, which is so important, the mitophagy and the autophagy. And that is really the trigger to healthy longevity. That is so important. Well, what else can fasting do? Well, we talked about it can help you to promote fat burning because if you don't eat, your body needs energy. It's going to use up its glucose stores. That's called glycogen. It's stored in the liver and in the muscle. And that's going to get used up pretty quickly. And then the only other energy source that is good is fat. If you have no fat on your body and you're basically just a very, very super thin person, that's why we don't recommend multi-day fasting. Because then when your body needs energy, it doesn't have enough fat to get to and burn up to create energy. It's going to burn up what? Your muscle and lean body mass. We do not want to have that happen. That's why if you have a body mass index that's below 18, you probably should not be doing multi-day fasting. It's not a good idea for you. There are other people who should not do it. Elderly, frail, really ill people, and pregnant people. We would not want those people doing multi-day fasting. Well, let's talk about some of the other benefits of fasting. It lowers oxidative stress, inflammation. which underlies all of the chronic diseases of aging. It can improve your gut microbiome composition and improve gut integrity. So it can help you to reverse leaky gut syndrome and have a better, healthier gut. And that should be like the trigger to having better digestion and maybe lowering risk of certain gastrointestinal cancers, because they have correlated an abnormal gut microbiome with a bunch of stuff like colon cancer, pancreatic cancer, and a separate kind of cancer is breast cancer. And I mentioned that 13-hour fasts are associated with reduced recurrence rate in women who've already been diagnosed with breast cancer in the menopause. So, there's a very good chance, not everything is proven, so I'm just saying that at least there is a potential, but what do we know? We do know it can help with gut integrity and improve the gut microbiome, reduce oxidative stress, and improve mitochondrial function, and along as a corollary is increase our production of that vital gas called nitric oxide, which maintains the health of the lining, the endothelium of our arteries. So it can really help to prevent coronary artery disease and other vascular disease. So what's related to those, like vascular disease, hypertension, and also having low nitric oxide? And there's actually data published that if you do fasting, you can, and you do like a multi-day water fast or preferably a fasting mimicking diet, and then you go on a healthy plant-based diet, you can dramatically improve your blood pressure. How fantastic is that? Well, I mentioned that we would talk about the difference between males and females and fasting. Well, I talked about when you are fasting, one of the things that our body has to do in order to create energy, which we need, is to burn our storage fat, right? Well, here's the thing. Where do you burn it? I already mentioned this, in mitochondria. Well, what organ has the most mitochondria and is the most able to burn fat? It's our muscles. Well, who has more muscles as a general statement, males or females? It's males. So males are bigger in general. We're talking about generalities. They are bigger, they have more muscle, and they tend to lose weight much easier than do women with fasting. So if you or a partner goes into fasting and you both want to lose, I'm just going to make this up, 10 pounds, who's going to lose it faster? He is, because odds are he has more muscle. Now, it's not just that. There seems to be some metabolic programming that's different in males and females. Women's bodies are designed to hold on to their fat. We think it's part of being able to survive famines and have pregnancies and raise our babies and nurse so that we don't die of starvation. And our babies don't die because we don't have enough fat stores to then have enough breast milk to feed our babies or to care for our young children. So nature actually doesn't want women to lose weight as readily as men. It wants us to hold on to our body fat. Because remember, during the history of mankind, fat was not like a problem. If you look back thousands of years ago, being overweight was not a thing, okay? Starving was a thing. Being very thin was a thing, okay? Not being obese. That is a modern condition, really, except for maybe the uber, wealthy and in every society, like maybe pharaohs were chubby, I'm not quite sure. But we know King Henry was chubby. But in general, when you look at the population as a whole, being overweight was not a thing, okay? Just maintaining your weight was a thing. So that's really an important takeaway, is that survival is what everything is about when it comes to genetics and how we evolved to survive so that we can successfully reproduce and be there to raise our offspring. And for women, that means not losing our storage fat. So we do have to work twice as hard as men. I've had so many patients who went with their husbands on fasting mimicking diet regimens, and the husbands lost like 14 pounds, and the women were happy, not so happy, but they lost maybe 6, which is still good, but less than half of what he lost, and they're working just as hard. when they did some studies with fasting mimicking diets, women had a higher dropout rate. So it is harder for us. We just have to work harder to lose weight. But we sure are more likely to survive the famine. So think about that. If we have a famine, we're going to be the survivors. So it is hard, but it is worth the effort, because even if you don't lose weight as much as you like, you're going to be so much healthier. So that's a really important thing. There are so many health benefits. Remember, gut microbiome, reduce inflammation. And what happens when you reduce inflammation? You reduce pain. Okay, that's really important. And you'll sleep better. You'll feel better. So there's so many benefits. Losing weight is definitely part of it for many people, but even taking that out of the equation, there are so many benefits. So yes, we have to work harder. We don't have as much muscle to burn, and there's something imprinted in us genetically that we are designed to survive famines way better than men. And famines are about long-term fasting, right? So we are designed better as females to survive a long fasting episode or starvation. So if you think of it, if there was a big famine and the men survived at a rate of 1 male to every 10 females, well, now you have a harem, and now the men can create new babies with the 10 women. If you had 1 woman survive to every 10 men, we're going to have a big problem, and our species can die out. In fact, some people think that's what happened to the Neanderthals. They were very intelligent, more than Homo sapiens. They had bigger brains, but they were not as good at surviving famines. So maybe the females didn't have the same ability that human females do to hold onto their fat and survive the famine. Men need to be able to create more energy, even in a famine, so that they can go and find food and hunt for whatever animals are out there and build and do whatever they need to do, while the women survived, had their pregnancies, raised the children, so that the human species could continue. It's, I'm not stereotyping, because I'm like, women can do anything they want. Like me, I want to do anything I want. But it's good to understand how we genetically evolved, so it's not going to be such a mystery why men have a better chance of losing weight more simply when they do these different types of fasting. And what about estrogen? Well, it turns out that estradiol is really important for the function of our appetite. Leptin, which is a fat hormone called an adipokine that regulates appetite, and also GLP-1. You know about them? They're what's all talked about all the time with drugs like Wegovy, Mounjaro, and all the offshoots. So here's the thing. Those hormones that are vital to appetite regulation and burning fat are regulated in large measure by estradiol. So I want to do studies. They don't exist yet, but I've seen it in my own practice. Women on hormones will do much better at losing weight and dealing with doing fasting, time-restricted eating, and the 5-2, the 4-3, fasting mimicking diets, water fasting. They will do better if they have adequate hormones on board, whether they're reproductive age or whether they're menopausal. And I want to get studies done, but I've seen this in my own practice. And by the way, there are now published studies showing that when women use what? GLP-1 receptor agonist drugs, and they're on hormones and they have estradiol replaced, they will lose more weight, because estradiol is really important for mitochondrial function. Remember, you can't lose weight if you don't burn fat, and you can't burn fat if you don't have functional mitochondria. And you will not have perfectly functional, happy mitochondria if you don't have any estradiol on board. So please keep that in mind. If you don't have estradiol, it's going to be much harder to lose weight. Now, there's no data that I'm aware of regarding hormonal contraceptives, but in my opinion, women will lose weight better if they are doing these fasting regimens, if they're not on chemical endocrine disruptors called hormonal contraceptives. But once again, I don't want people having unwanted pregnancies, so you have to do what you have to do. But just if that's not important that you be on a contraceptive, please keep that in mind if your goal is to actually get optimized and lose weight and reduce inflammation, improve your gut microbiome, reduce oxidative stress, increase vascular health, reduce hypertension. All of that is best if you're having your own natural hormones, if you're reproductive age. Now, what if you are reproductive age and you want to do a multi-day water fast or a fasting mimicking diet? Where in the menstrual cycle should you do this? And I know this has been debated, but I looked at the data. There's not a whole lot, but the data that exists are using water fast for 2 and 3 days. I didn't see anything beyond that. But here's what we do have. You are much better off if you do a multi-day fasting, a periodic fast, and you're a woman of reproductive age and you have natural cycles after ovulation in the 2 weeks preceding the period onset. That is after ovulation. And why is that? If you do any form of multi-day fasting, even like a 1 day, but the studies were with 2 or 3 days. If you do it during the follicular phase, or also known as the proliferative phase, pre-ovulatory stage of the menstrual cycle, having that energy decrease can cause ovulation to be less effective, so you'll get a less quality ovulation, or you can even stop ovulation altogether, particularly if you're a thinner woman. The heavier you are, the less you'll interfere if you're having regular cycles. But why even take a chance? You want to ovulate. You want to have your own natural hormones working properly. Isn't that the goal? So when you do any multi-day fasting, do it after ovulation. So if you're not sure, just do it in the week before your expected period. Now, what does that do? Well, it's also what it doesn't do. It's not going to prevent proper ovulation. That's been published. And what else does it do that's good? So it's not going to prevent ovulation and mess with your hormone production, but it's also going to increase vagal tone. It actually modifies in a good way the autonomic nervous system so you have more parasympathetic and less sympathetic. In other words, it's calming. It makes you have proper motility of your gut. You're going to sleep better. You're just going to feel better. So it's wonderful. We want to have increased heart rate variability. They have published studies showing luteal phase, second half of the menstrual cycle, fasting for multi-day, 2-3 days, and I would assume, but I can't prove it, that that would apply to fasting mimicking diets or a 3 or 4 day water fast, that it will actually improve the heart rate variability, which means you're increasing parasympathetic output vagal tone. So please, if you're going to do fasting and you have cycles, do it at the end of the menstrual cycle, before the period, but after ovulation. Now, if you don't care about fertility, you could say, but what do I care if I don't ovulate? Well, because you want to have normal hormones and normal cycles. So even if pregnancy is not an issue, please do your fasting after ovulation occurs. And of course, if you're in menopause or you happen to be on birth control of any form that's hormonal and you're not ovulating at all, then it doesn't matter. Okay, then you can do it whenever you want. Right? So menopausal women can do it whenever they want. Now, you could say, but what I recommend cyclic hormones. So we don't have any data. We're not going to interfere with ovulation. You're not ovulating when you're in menopause. So we don't really know. But the data we have is when you have progesterone. So maybe that's the best way to do it. I don't really know. There's no published data. But if you're going to have the choice and you're in menopause and you're doing cyclic hormones like I recommend, maybe do your multi-day fasting when you're on the progesterone, because maybe it'll do some more good, because it does if you're having natural cycles, but we don't really know. So fasting is good for you. It's not always easy, but it is worth the effort. If you're not ready for multi-day fasting, periodic fasting, start with just time-restricted eating. Get your 13-hour fast from dinner to breakfast. Stop thinking that intermittent fasting means you don't eat until 1 p.m. or such. That is not the way the human body evolved. We have clock genes. Everything works better when we eat in the first half of the day and put more of our calories in early than late, unless you're trying to be unhealthy and gain weight. So I don't think that's your goal, nor is it mine. So try to live with our circadian rhythm, help your gut to work the best it can, help your hormones to function properly, your insulin to be optimized when you eat, and you'll get the most benefit from your fasting regimens.